working in the field of health education, health promotion, community health and prevention for many years. And I'm really happy to share with you some ideas to introduce this 3-day session. The key word for me is that when we talk about community health, and this is what I'm going to explain during this talk, we are not talking about a theory and the application of a theory in the field. We are talking about doing something, doing community health, because community health is based on practices. I would like to share with you 5 ideas, and you'll see that my presentation is very detailed in order for all of you to be able to find some ideas if you are not able to catch it during the talk. And don't forget, this afternoon we will have time to talk about these different elements during the second half of the day in your language, in Arabic, in Spanish, in English, in French. And then we will be able to probably go more in depth in what I'm going to present now. So this introduction is based on 5 key ideas that could be a kind of a foundation for this global community we are. The first idea is that community health is, first of all, a discourse and a diversity of practice. The second idea, it is based in history, cultures, and different contexts. That's why it's so precious, so important to be from different countries in this meeting. The fact that this is the idea number 3, that community health is at a crossroads between health, social, and education field, and then move to try to say what is specific to community health. And this is what we call a configuration, and then to move to the kind of practices we are doing when we are doing community health. So the first thing is, all you know that when we talk about community health, of course, we are talking about local intervention, local policies, local actions, but in a wide diversity of contexts and with a very large diversity of approaches, from primary health care to interventions with the most vulnerable people of the communities, to actions linked to the living environment, or the commitment to the social change in different areas, with the participation of the people and a strong trust in the possibility of emancipation and empowerment of the people, with then a focus on capacity building. If you try to have a look on what people are talking about when they talk about community health, you'll see that there's 3 key groups of definitions. There's no need, of course, to try to watch. It's probably too small. Again, this is for the rest of the week if you need to come back to these definitions. The first view we have of community health, it is oriented toward health services. This is a specific way of organizing the healthcare services that is delivered to the population. Healthcare services based on proximity to the people and integration with the social care. This is also a nursing or a medical specialty with people, the community health workers, who are specialists of this work at the local level. And of course, some places, dedicated places, that are linked to the different facilities used at the community level to contribute to the health of the community. So this is linked to institutions from a point of view of community, from healthcare. The second vision is linked to the people. It is a collaborative approach This is working with the community and not only for the community. And the fact that also the community health workers are not only professionals, not only healthcare professionals, but members also of the community. The third approach of community health is oriented toward social change and increasing the community control over the determinant of health, working on the needs of the population and developing the different kind of policies, practices, intervention that could influence the determinants of health and giving the means to the population to take care to their own health in a responsible way. Of course, this is a kind of definition that uses the focus of health promotion. If you try to summarize what we are talking about when we are talking about community health, it is clearly, sorry for that, it is clearly the idea of involvement, social transformations, specificity of the role of the community that appears to be critical for the definition of community health with a vision of equity, social justice, participation, empowerment, health as a human right. The point is that knowing that, we cannot imagine we're going to produce a unique definition of community health at the end of these 3 days. We have to acknowledge that community health is based on practices and it is linked to a wide variety of realities. You are community health. You are the people who are doing community health. You are doing it in different ways, in different contexts. That's why what is extremely important is to share this richness, this treasure of the knowledge we have developed in different countries, different continents, different places on the way in which we could really improve the health of the population at the community level. But we don't have to be scared by the fact we have a large diversity of practices. What's going to be interesting during these 3 days, and especially in the afternoon session, is that we're going to be able to make links between the different kinds of practices linked to community health in order to learn from other approaches. So knowing that, of course, we have to clearly say that community health is not a paradigm, this is not an approach, this is not a strategy, this is social practices. And based on that, we could have a more bottom-up vision of how to build the field of community health and the community, as Eric Breton said early today. Community health is based on social practices. You are the practitioners of community health. So what do we have? We have a discourse. We are talking about community health, and we are these practices, but this discourse and these practices are rooted in history, cultures, and context. So it means that there is no chemically pure community health that is universally recognized. We have the chance to have a diversity of practice, and then all these practices going to nourish the field of community health. This is the first idea I would like to share, and I think that this afternoon it's also going to be something we will be able to discuss on. The second important thing to set the scene to these 3 days is the fact that every vision of community health is rooted in history, in cultures, in context. If we come back to the period during which community health was hugely popular, it means during the 70s, beginning of the 80s, it was at this time part of the policy of many countries throughout the world. And the source of this vision of community health, and of course, we're going to talk about what happened later, is clearly based, first of all, on South American sources, and you have the photo. I suppose most of you know Paulo Freire as one of the person who theorized the popular education, the fact that the objective is to give the power to the population, and also examples, and one of the most famous was from North America and the neighborhood health clinics in Chicago in the 60s. All these initiatives were based on participatory and multidisciplinary approach, not only to prevention, but also to primary health care, primary healthcare services. This origin is still, of course, very important because it is the foundation of the community health today. But of course, depending on the political situation, for example, the level of decentralization of the country, the geographical context, the fact that you are living in a remote area or in a very dense urban area, the socio-economical situation, the way in which community health becomes a practice is very different from a place to another. Of course, like every social practices, it generated in certain contexts an institutionalization, the creation of institutions, and the development of health resources that are dedicated or not, and it's very different from a country to another, with a professional identity and with a training programs for these community health workers. It also generates a lot of research and an analysis based on the population needs that led to a global dynamic, because the determinants of health on which you can have an action are mostly at the local level, even if there's also distal determinants. The local determinants of health are extremely important, leading to different kind of policies, institutionalization, human resources. This is where we are. And I would say that it is a very open field, because every context has its own history in relationship to community health. The third idea is that we need to move to a kind of understanding of what is community health and how could we define it. In our vision, community health is a configuration. You cannot, again, say this is or this is not based on a unique definition, but there's things that are common to most of the approaches of community health at the global level. The fact that, first of all, it is oriented toward health and well-being improvement, social development, health promotion, prevention at a local level. This is something which is common. The method, there's a large diversity of methods, but most of them are based on involvement of the population, participatory approaches, methods for needs analysis and evaluation. It's also the fact that the concepts and theories that are behind are mostly based on ecological model, constructivist paradigm, theories of social change, participation, action on the social determinants of health. There's also behind key values: emancipation, empowerment, social justice, political commitment, and the fact that the diversity of actors involved is far beyond the group of the healthcare professionals, but also involve the citizens, the population, the community and the associations, the NGOs, and the different kind of professionals. And what is extremely important when you have a global view of health, community health, is that there's privileged space for interventions. This is mostly vulnerable populations, actions linked to the living environment, the access to primary care. All these different components are not common to all the interventions, But what defines community health is this kind of configuration. There's not only a close definition, but there's different components, these 6 components, that are arranged in different ways, in different contexts, but in a way or another, these components are common to the approach of community health. And this is the basis of what we're going to share. During these 3 days, we're going to work on the way in which this general configuration is applied in defined practices in different contexts. So community health is then more a crossroad than a discipline in itself, because of course it's not only one limited group of measures at a local level, for example, changes in the environment or action on on poverty and the socio-economical determinants of health. This is more all the kind of measures that can ensure that each member of the community have a standard of living compatible with his or own health and having an action on the different determinants of health. So community health is clearly at a crossroad on social dynamics on the one hand, and health promotion and protection interventions on the other hand. Social dynamics, because health is part of the well-being of the people, health promotion and protection, because social determinants at a local level are critical determinants of health. So community health is the meeting point of social health promotion and protection dynamics. If one wants to represent that, we could make such a figure. You know, you have the horizontal axis, which represents the social dimension. The horizontal axis corresponds to the social dimension of community health, and the vertical axis corresponds to the health dimension of community health, because the field of community health is in between these 2 dimensions. And of course, it finds expression in different kinds of practices, but all of them are inside this social and health field of practices. Talking about community health, it's talking a field and practices within this field. There's access to primary care as a key field of action, health protection at the local level, linked to all the actions on the environment and the access to the resources, prevention, intervention on the living environment, capacity building to increase people's power on their health in a health promotion approach, social change toward health for all, and this is clearly the contribution to social change and social dynamics, and the specific focus on vulnerable people. We are here in a field, not only one definition, but different practices that are all have a component, this is the vertical axis, a component linked to health and a component linked to social issues and social dynamics. This is the horizontal axis. What I would like now you to do is to tell us where you are, and please, based on your current activity or your future activity if you are a student, we would like to ask you to indicate where you are located on this figure. There's a field between health and social determinants. Where are you? What are you doing? To do that, we ask you to go to another WooClap, www.wooclap.com/communityhe, like community health, and to find where you are. And of course, you can choose as many areas as you need. If you work in a community health center, you probably work on the access to care. And if the community health center is involved in the capacity building of the population, you are also in the other field inside. So please now go to the WooClap. You have the address of the WooClap in the chat box, and then you can tell us where you are. Do not hesitate to choose as many areas as you need. The floor is yours. Please go to the WooClap and tell us where you are. I suggest we take our time to do that, and we're gonna give you the time to do it. As expected, you are everywhere. So please take your time, and if you're not familiar with WooClap, take the time you need to tell us where you are. And you have on your screen the positioning of all the people participating to this meeting. "94 people have participate. And what is great is that some people are not in the different areas. Just because, probably, and we're going to talk about that this afternoon, just because their activity is between, mixed, take into account different dimensions. 2 more minutes for all of you to position yourself in the field of community health. And do not hesitate to position you in different areas depending on your professional activity or your future professional activity or the field for which you have a real interest. Thank you very much for your contribution. I just would like to tell you that we are very lucky because we have people who work in all the different areas of community health. This is exactly what we need, learning from the different practices that are linked to community health. So please keep in mind that we are all positioned in the field of community health in different ways from different perspectives because we are practicing community health in a different way. And now, please, we could move forward to talk about another important positioning, because knowing that all of us are working in different kind of a context, we also need to tell where we are, not only in terms of practice, but also in terms of geographical situation. So now, please move again to the WooClap in order to answer the next question, which is, where are you? This is the same method. Please just position you on this global map. And you can see that we are everywhere. from Asia, from Africa, from North America, from Europe, from South America. It's not surprising that we don't have a lot of colleagues from Australia because of the time, and this is an issue for us because we are in the middle of the night in Australia and in other regions. So please tell us where we are, where you are. Take time to fill this WooClap because it gives you a vision not only on the practices, but a vision of where are the participants and the people with whom you're going to work for the 3 days of the annual workshop of community health. Clearly, we are from everywhere, from all the different countries on the planet, and this is exactly what we need to learn from different kind of practices, Middle East, Maghreb, Mashrek, and all this region, Eastern and Western Europe, Indian Ocean Islands, India, South Africa. So this is where we are, and we are community health. So this double positioning is extremely important because it tells this positioning is very important because it tells us what is community health. It's different of practices in different contexts, different practices in different contexts. This is exactly where we are because community health is what we could call an umbrella concept, where you have a lot of different practices, diversity of program, policies that aims at addressing the health needs of the population at the local level. And yes, you can see community health and practice community health through the lens of health promotion. You can do it from the lens of primary care services. You can do it from the lens of popular education, from prevention. All that different approaches are fully legitimate because again, we are community health. Because in common to all of that, there's intersectoral action, engagements of social actors, even if the level of institutionalization is totally different. So perhaps some of you could be scared saying, oh my God, it's difficult to define community health. No, this is just the field of practices as it is. It is just the reality. And again, nobody can say, this is the definition, the unique, universal definition of community health. We are community health. And of course, there's blurred interaction. There's a lot of overlaps with public health, educational, social-based initiatives, health promotion. Yes, there's overlaps. But again, we are talking about the reality, not the theory. The field of community health is built by your practices, by the ways in which we are doing community health, because community health is doing. I know it's a bit strange. It's doing, it's a practice. It is doing something. It's not applying. It's not implementing. It's depending on the time and places to build, launch actions that aims at having an influence on the different determinants of health at the local level. So having in mind our positioning, you remember the first WooClap showing that you are everywhere in the social and health field. The map of our little beautiful blue planet, because you are everywhere. Having that in common, let us have to move to what defines this doing, to go in depth to inside the configuration. You remember the 6 domains, and to see what's behind. And what's behind doing community health? It's having in mind a strategy of social change. It's working through an ethical framework, taking into account the complexity of the real life of the people, and to recognize the different knowledge of the population, knowledge of the policymakers, knowledge of the researchers. What is doing community health? What is behind this doing? This is, first of all, a strategy of social change. Everybody working in the field of community health, think of the way in which we have to reorganize the community, the access to primary care, the organization of education, the change in the buildings, the access to services, the fight against poverty, in order to move forward and to give the means to everybody to have access to a better health. This is contributing to a strategy of social change at a local level. And to do that, we need to work on the determinant of health and always have this vision of working on the environment and working on the capacity building of the people. We have in common to have this vision of improving the community in the objective of having a positive influence on the determinants of health of the people. The second thing that defines this doing is the vision, the ethical framework. All the practitioners have in mind the importance of empowerment. Whatever the way in which you can define this vision, there's always behind an ethical framework. And for example, you can express the ethical framework based on principles, and this is the SEPSAC principles with, for example, and this is again one example, there's different, but this vision is a comprehensive and positive approach to health, the action on the determinant of health, the intersectoral action, the planning and the strategy process, a method. They work with the community and not on the community, the involvement of the people as an objective, the idea of sharing power and knowledge, and to increase and share the resources of the community. This is one example of the kind of vision we have. You remember, first, strategy for social change, then ethical framework. Now we move to the question of the intersection of knowledge. Because what is specific to community health is that it is a social practice in which knowledge from various social practices flourish. This is the knowledge of the people, the knowledge of the community, the knowledge of the population, the know-how, because everybody has to organize his life and to protect his health in the different contexts. This is also the knowledge of the professional, the institutional experts, and the scientific knowledge. What is the foundation of community health is the fact that it takes into account the health of different actors and not only one. And of course, everybody knows why. This is just because we are talking about the real life of the people, not the theory. And I really love this quotation of Boaventura de Sousa Santos, who say that if you want to go to the moon, you need scientific and technical knowledge. But if you want to preserve the biodiversity of the Amazonia region, you need indigenous knowledge. And I add that if you want to have an effective community health, you need both the scientific, the epidemiological and the technical knowledge, and the knowledge of the population. This is why we are talking about ecology of knowledge, the way in which we can articulate and put together all this knowledge, having an equal respect for all that kind of knowledge, but of course knowing that it's complex and there's a need for an intercultural translation, because it's not so evident to create a dialogue between the knowledge of the people and the knowledge based on research. The final dimension that could be considered as common to this doing is the fact that we are accepting the complexity of the life of the people. You cannot create a dynamic of community health without acknowledging what is the real life. It means the different dimensions of health. Without, knowing that there's cultural and social foundations, there's question of power, of resources, the question also of the Western values, the neo-colonial ideologies, the question of dominance. We, of course, have to acknowledge that it's long-term processes, that there's not only one pipe, but a diversity of kind of intervention that increase the health of the community. So, taking complexity into account, acknowledge the complexity of the real life of the people is absolutely crucial in community health. So yes, if we want to develop people's and population capacity to maintain or increase their health through community health actions, we need to have in mind the fact that we are working to change the community based on an ethical framework. We are taking into account the diversity of knowledge and also the complexity of the real situation. And then, of course, community health is always involved in the social movements. It cannot be outside. It is clearly in the middle of the life of the people. So to conclude now, I just would like to share with you a way of organizing the different practices of community health. You remember the idea is that community health is not defined one for all. This is more different practices in different contexts with different people that are rooted in history, cultures, and context, and that are defining different kinds of intervention and taking into account the context. So these practices are a number of 4 practices for doing. The first one, when we are talking about community health, we are talking about the practices, the doing of the people. When a mother takes care of her baby, this is clearly a practice. And this practice is linked to a context, to the knowledge of the mother, to the environment, to the service she receives. And these practices of the individual, of the population, is one of the practices of community health. And of course, since our objective is to improve the life of these people, knowing what they are doing, respecting what they are doing, enriching their practices is absolutely critical. So community health is, first of all, the practices of the populations. Secondly, this is our practices, the practices of the professionals, the community health workers. This is the practices of the different stakeholders, because community health, just like health promotion, has the characteristic that the people who are working for community health, it's not only professionals, it's also unionists, it's also people working for NGOs. This is citizens, this is elected people. Second group of practices, the practices of the professionals and the stakeholders. There's a third group of practices, the one of the policymakers, the one of the institutions. And these practices refers to the implementation and advocacy of public health policies at a local level, not only, of course, the health sector, but all the sectors that influence the health of the community. The doing of the population, the doing of the professional and the people involved in community health, the doing of the policymakers, and the doing of the innovators. It means the people who are involved in creation of knowledge, in publication of documents at the local or wider level in order to improve the practices by doing research, by sharing the different data, but contributing to support and to promote community health. These 4 practices, people, professionals, and different people involved in community health management, policymakers, and innovators, these 4 practices are clearly linked. But what's the most important at the end of the process? And that enables the success of the failure of our endeavor, it's the individual and the populations. So just to conclude, we have to have in mind that these practices are not only our practices. When we are talking of community health practices, we are talking about the practices of the population, the one of the policymakers, and the one of the innovators. So the 5 ideas I just share with you is the fact that we are talking about practices, that these practices are clearly rooted in cultures and contexts, that they are based on the contribution of different fields in order to make possible and the creation of a favorable environment for the people and developing their capacity to take power on their health, a configuration that helps organize and have a vision of what is doing community health and for group of practices. In any cases, community health is something shares. It's contributing to building bridge between different contributors to the population of the community. We are community health. We have now 3 days to share our different visions, our different practices to learn from each other. Thank you very much.